Hi everyone, welcome back. Today we're going to talk about black triangles and how to treat them. So black triangles are these areas along the gum line where you are missing some of your gum tissue. There's not enough to come up and make a nice triangle. So basically there's a void, and from far away, those voids look dark, almost like a little piece of pepper is stuck in between your teeth. And that can make people feel really self-conscious, especially when other people start to point out that you may have something stuck in between your teeth when really it's just that there's a missing piece of gum there. I'm a cosmetic and restorative dentist. I treat these all the time, and there are two main reasons that I see people have these. The first reason is the shape of the tooth. Some people have triangular shaped teeth, and there's not enough oomph at the base of the tooth to push that gum together into a nice triangle. The second reason is post-ortho or post-Invisalign. Yes, you can get black triangles after orthodontics. And it's very, very common. It's not that orthodontics caused the black triangle, but you have to imagine it like this. When all the teeth are crowded and scrunched together, the gums are also scrunched together. When you put all the teeth in the place that they're supposed to, sometimes, especially if you have a triangular shaped tooth like what we just talked about, there's not enough gum tissue to really fill in that area. So it's kind of a trade-off. Your teeth are now in the proper position, but the gums are causing an issue with black triangles. What can we do? There are 4 main treatments to treat a black triangle, and I'm going to tell you straight which one of these works, which of these don't work. But before we move forward, if you haven't already, hit the subscribe button and hit the thumbs up to let me know that you love videos like this. The first treatment is Bioclear, and I do Bioclear all the time in my practice. It is a great treatment because it's pretty conservative. Bioclear is a procedure where you add composite to both sides of a triangular shaped tooth to push that gum back together. Bioclear is a very attractive and popular treatment for a couple of reasons. Number one is that it's really conservative. We are just adding composite and we don't have to drill any of your natural tooth structure. Number two, it is actually pretty instantaneous. You just go to the dentist and within 2 to 3 hours, they will fill up that space and you will leave without the black triangle, all under local anesthesia. That is really cool. However, there are also cons to this procedure. Number one being you have to go to a very experienced cosmetic dentist who does these all the time because it is a more technically difficult procedure to deliver and to deliver well, especially because we are manipulating the gums in this procedure where we are adding composite and squishing the gums together. And so we are extending the composite slightly under the gum line. And if this is not done seamlessly, it'll cause irritation, constant irritation and inflammation to the gums. Another thing that people who are interested in this procedure have to realize is that by adding composite to the sides of the teeth, we're actually widening the tooth and making the teeth look fatter. And depending on your aesthetic, that may not be something that you want. However, what I find is that people do not mind if their teeth look wider. What they do mind is that void in space. So having teeth that are wider almost all the time looks much better than having a void that looks like a little piece of pepper that's stuck there all the time. Again, if you go to an experienced cosmetic dentist, there are ways for us to camouflage how wide the tooth looks by carving it a certain way. I like to use this example. It's kind of like when you contour your face. Your face is just as big as it was before, but the contours make it look skinnier and whittled down. The last major thing I think people should know is that these don't last forever because it's composite. Composite is more porous and will absorb stains. So over time, it will need to be replaced. I would give it a time frame of about 5 years before you really start to notice all the staining and need to have it replaced. The staining really depends on the patient's lifestyle and habits. So if you drink coffee every single day, there's a higher chance that this will need to be replaced even sooner than in 5 years. The second treatment for black triangle is to actually do Invisalign. Now wait, I thought you said black triangles sometimes happen after Invisalign. They can, but you can also fix small to medium-sized black triangles with Invisalign. So remember how I was saying sometimes you have a black triangle because there's not enough gum to fill in that entire space? Well, we can utilize Invisalign paired with IPR. IPR is where we use a sanding disc in between the teeth to remove just a small layer of enamel. And what that gives us is space to move the teeth closer together so that the gums can come up back into that triangle. So again, this only works if it's a very small to a small medium black triangle. Large black triangles will not benefit too much from this. And you will need to weigh whether it's worth removing a small layer of enamel to bring the teeth closer together. Now, I know it sounds really scary to remove a layer of your enamel, but it is something that is very predictable in the right hands. In most cases, we are literally removing like 0.2 millimeters, and it's very, very calculated. If it makes people feel better, I actually did this treatment for myself because I had black triangles along the bottom and also between my 2 front teeth. So I love this treatment, but it has to be done on the right candidate. The third treatment to fix a black triangle are veneers. I do a lot of veneers in my practice, and we do fix a lot of black triangles with veneers. Veneers are a good option if you wanted a cosmetic enhancement anyway. Like for example, if you have a little chip at the edge of your tooth and you wanted to repair that, let's get that all in and fix that black triangle at the same time. It's also a bit of a longer lasting treatment than doing Bioclear, which is made out of composite resin, absorbs a lot of stains. Because veneers are made out of porcelain, it won't absorb those stains quite as easily. But make sure that you go to an experienced cosmetic dentist, because closing a black triangle with veneers is a higher level of difficulty that only an experienced cosmetic dentist would know how to execute. Veneers may be a good option for a small to medium-sized black triangle. If the black triangle is too big, it may not be possible to fully close the black triangle with veneers. Now, what people will notice with veneers is, just like in the Bioclear example, the tooth will look wider because we are widening the teeth in order to close that black triangle. However, the beauty of veneers is that the more teeth we do, the more we can distribute the space. If you only did 2 teeth in the front, there's not much to distribute, and so those teeth will look wider. And again, that is okay. I find that people prefer the look of the wide teeth to having a black triangle. Like from far away, people are more likely to notice a little black space or a void than to notice that your teeth look just a little bit wider. So overall, this is a great treatment in the right hands and for the right person. The fourth treatment option for a black triangle is to use filler. Yes, filler, like the stuff you'd put inside of your face, into your gums to plump up the actual gum tissue. Now, it sounds really promising. I was very intrigued. I thought it would be a game changer. So I went out, I learned how to do Botox, filler, the whole thing. Not super impressed with filler in the gums, sadly. First of all, it is not a very long-lasting treatment. For the price of what filler is and the amount of times you have to keep coming in to get it done, it's just not the most sustainable option. The second thing you should know about filler is that it's only really a good option if you have a very, very small black triangle. It's limited in what it can do because you have to imagine being able to stretch a piece of gum with that much filler. It's not like your face, it's gum. Gum tissue is a lot more stiff. So it just won't stretch in that same way. And I've talked to so many periodontists about filler. I have not met too many periodontists that are like gung-ho about filler to fill in those black triangles. Like, it is a very limiting procedure, but in the right hands and in the right candidate, it can be an option. All right, those are the 4 treatments for black triangles and my honest opinion as an experienced cosmetic dentist who sees them all the time. I know they are super frustrating, but hopefully this will help you. If you found this helpful, please hit the subscribe button and I will be back next time with another video. Bye.